Hello everyone, what's good today? So today with me here are they with
Dr. Abukanu?
oh Dr. Kanu. It's
Yeah.
a pleasure to have you here today and I'm so happy about this. And guys, today this man here a medical doctor and today we there for discuss on the topic malaria. We all know what's in malaria. Though some no know because some just they treat malaria anyhow you feel like for treat am. I believe say when you know about something, you they take caution and you they take care of am. So today a medical doctor there for can talk on malaria. So Dr. Abukano, it's a pleasure once again to have you on my podcast. So firstly, I want to ask you what's in a malaria, the concept about malaria in order to make you educate the viewers then.
So malaria, as we all know, not just a disease where they caused by a parasite,
Okay.
where they transmit that parasite and the mosquito na in the transmitter. The female Anopheles mosquito na in the transmit the malaria parasites. So then they into different types where mainly Naja Salon to be specific, the way we get in Africa, specifically Salon, na the Plasmodium falciparum. So other side dem get Plasmodium vivax, Plasmodium malariae, Knowlensi and the other types wey dem dey but specifically salon we get Plasmodium falciparum na the malaria parasite and so when the mosquito bite you, the female Anopheles mosquito when e bite you, if e get the parasite, e pass am to you. If another mosquito wey no get the parasite e come bite you, e sef dey get am then e transmit am to another person. So that's just how that is just the basic about malaria where the person end up forgetting the symptoms like they feel fever, they ache the heart, and the person can tremble, they feel like weakness, muscle pain, and other worst thing that will happen if you are not treated.
Wow. So I believe for say that now they spread how the mosquito they spread the infection or
Yeah.
the
Mhm.
disease. So actually go on for know the prevention way we for take in order for make we be prevented from this disease or this infection caused by the Anopheles mosquito.
So malaria na infestation way is preventable, like you already mentioned. Just target the side which I can get.
The cool side
Yes,
also.
the side way they can get malaria, which I malaria they breed, like then gutter then. The water the way they settle, na dem small small hole there na the backyard. If you get can, the old can there or rubber or pan, sorry, wey water dey settle inside it. If you get tire dem, the old tire dem wey dey team up na the backyard which water dey settle or gutter pass or near the sea or river, that was the waking dey near river or then swampy areas dem. So for prevent malaria, first of all, prevent the mosquito from bite you. How for prevent am? You can able prevent am for staying at the community. How? Clean the community. Clean. If water settle pan pan, throw am. If the water settle pan tire, inside, throw am. If na small hole inside water settle wey mosquito can breathe, lock that hole dey make water no settle there again. If na gutter, then you cover am. Next thing dem use cement whatsoever there cover the gutter. Water go dey pass under so water no go dey settle where mosquito can breathe inside. And for clean the environment, you can use mosquito net also. You can use mosquito nets, sleep on a mosquito coil. They even the mosquito repellent, they don't carry it, and then cream them. Even though not 100% accurate, but they can also help mosquito coil and many other things. We once then I do for because mosquito not to inside room where they bet you. People waiting I do wear long thing them, dress, wear socks, thing them wey you know say no more mosquito not go bet you outside. So that
Uh,
is it.
okay, so you mentioned about coil, mosquito coil, and recently, me, lately, when I dey sleep under mosquito coil, when I dey put mosquito coil on my room, I dey find out for say in the morning, I dey get a fresh cold. So then they make them mosquito coil there for make we get prevented from these mosquito coils. So, but yet still, this mosquito coil they make we get cold. Why this dey happen, or is it that they make am in order for make we also get fresh cold? I don't know if you ever experience this.
No. So one thing we for know is that when it comes to health, it's specific for one person. It can be different for another person. For me, I light in a room 20 mosquito coils. I okay, I sleep, I wake in the morning, I okay.
You need a cold.
But another person, it can be different. Well, I don't want to go back cold. I don't think it's causing cold, as you are saying. I think say some people they're just allergic to certain things. So
Okay.
because of that, the reaction wey dey cause for you, na dey lead to the symptoms the way they refer as cold. Because common cold, if I can say, na viral and other causes. So it's not like you can just get am just like that. So it just can be just be a reaction from the mosquito coil, some of im constituents dem, the smell, the scent and everything wey person dey react to. So if you that thing dey no good for you, change am, do another thing, do other preventing measures, change am. Even medication no dey drink, other person dey drink dey cure, other person dey cause other problem. So change the medication.
Okay.
Yeah.
So late last year I saw you went to the village, right? Or to be specific, a village, and una go do this vaccination to some pikin dem. I think that redeem, right?
Yes.
So I want make you talk about this vaccine and the ages of the people wey suppose for get this vaccine.
So first of all, we no be yes, we been go na village, we been get an initiative wey redeem, we
Okay.
organization wey form wey dey target rural communities. Upon we sef, with the help of the Clarissa and Sisters of Nonsa, we dey do outreaches there. We
Okay.
go na one village, other villages, we not to vaccine we dey give. Vaccine is supposed to be a government regulated something.
Okay.
Yes, so we are not giving the vaccine. We go test the pikin dem and then we give them medications dem for free. You understand? So e go shock you for know say one village we go, we check about 47 pikin dem, 38 of them, all of them are positive.
Wow.
Yes, so that is to tell you how worst malaria can be, how it can be endemic in some particular community. A small village, 47 pikin,
Everybody positive.
38, almost every, because that is
Wow.
almost everybody is positive. So
Yeah,
you
sure.
can imagine if we were to check the elders, we checked only the younger children, not elderly people, not adults, the children.
Wow.
Yes, so that is what we did. So that was an initiative we did last year, and with the support or within ourselves we can decide for do further. So not all vaccine we give. The vaccine,
Okay.
then again at government hospitals, government clinics.
And they're always entitled.
Yes, it's free.
Okay.
It's supposed to be free. It's supposed to be free. Yeah, we cannot visit all communities. Salon anything possible. It's supposed to be free. Yes. So at the age 6, 7, and up to 18 months, then they give to the beginner. You understand? So not to just one dose number, don't know. And they supposed to follow up. That is how it's supposed to be. Yeah.
So I want to know in this case, why is malaria cases and deaths still so high in our salon despite the effort the Ministry of Health and also um, I can say medical practitioners that they put in place for make this disease here so end? Why?
Why it's still high, even
Eh,
though they put the efforts.
yes.
So first of all, the efforts they go on, but at every level there are problems. We apart from malaria, any other thing we want target na salon to be specific, because we are talking about salon.
Yeah.
We need for target at every level. Salon na they will grow, we know how corruption they at every stage. Most of the time we talk about government, we are all part of the corruption. You understand? The small one, the small one they say within their offices. It's just that them big one and they thief big. But who dey thief the small one? So corruption na part of the thing. For
Okay.
instance, about over 500,000 doses of vaccine wey dem introduce in April 20 something 2004. Na im dem introduce the vaccine. So it's supposed to be free. First of all, the support from international organizations, WHO, CDC, or whatever organization that is supporting. The first question is it that all they are given that is coming to the country? When it lands in the hands of the president or the minister, is he or she passing everything to those below? That's another question. The other question, those below, when they receive, are they passing it to those lower than him or her? That's another question. And down to the DHMT, District Health Management Team, finances or medications or whatever they are getting, are they going down to the level as they are supposed to? Those are all questions we can't, I don't have answers. Then lastly, to the community people, the behavior of the people. Vaccine, people dey answer alone dey tend for misunderstanding. Yes, we dey say government this and that, government that, but the small effort wey dem dey do. Yeah, you can say dem no dey do to expectation. Na person, na your own opinion. But okay, whatever small now dem dey do, wetin na your perception towards that? Let me say dem suppose to count 10 vaccine, dem count 2. That 2 wey dem count, wetin na your perception towards that today? People dem dey say am say dem dey make sickness dem, dat gangi medicine. Dem dey make sickness dem for let dem get money. People dem get their own interpretation. So if we wan for prevent malaria, we need for cut the chain. We need for address from the chain from up take am down to the village man, change dem perception. Lecture about wetin mean for make dem adhere to wetin dem dey tell dem.
Okay.
Yeah.
So there isn't something where before say life experience for me, and there are times when I dey feel sick because me common illness na malaria, typhoid malaria. So I dey go Google and say wetin are the right treatment in order for make I able, because wetin I don observe is that most people wey dem call themselves pharmacists, wey dem dey na the pharmacy, they no not to a legal
Not to a pharmacist.
practitioner dey.
Dem dey na the pharmacy but not to a pharmacist.
Yes. So I can take and see they don't sabi the medicine exactly. If I go explain give them how I dey feel, they're not able to give me the right medicine where I want. So instead of me going there to ask them, and they can't search on Google, where I know say a bad thing. So I want for know wetin are the advice wey you go give me in order for make I stop for search on Google and do wetin are the need for the right thing.
So first of all, there is nothing like typhoid malaria.
Okay.
Nothing only like typhoid malaria. Typhoid dey on im own, malaria dey on im own. They are not caused by the same thing. Yeah, of course. The only relationship we dem get is that they all link common air. And then they most times intertwine and they most times occur almost at the same time. Sometimes people they don't take the all, so they don't bond them together. When you get typhoid, you forget malaria pauper. When you get malaria, you forget typhoid pauper. No, that is not true. Do you understand? So, and coming to the pharmacist, as you say, you are right. Majority of the time, sometimes I can just pretend I don't know anything. I go to the pharmacy. They are business people. Majority of the pharmacists in a salon are business they do. They don't care about what they go do with the medicine, whatever. They don't care. And majority of the people that work in the pharmacy, they don't even know what they do. That is the truth.
Yeah.
They are not real pharmacists. So no problem. So if you first of all for go ask them first, you're not safe. So go to a somebody will qualify, what you know, say a qualified person, and tell you what you for do, then you go to the pharmacy. The pharmacist now for go administer and for go give you what you doctor don't prescribe or the medical professional don't prescribe. You go take an. That is how it should be. Except if your availability not there, then you go to the lower kidder. You get me?
Yeah.
So that is how it should be in the first place. So go to Google. The Google where this like you say, if I go to Google, go search for something.
Yeah.
At the time for free, you always advise me for ask a medical practitioner, doctor to be specific. If you know they go to the lower kidder person where they because if you decide to go chat na Google now, you might get the answer. You get the answer to what you are looking for. But first of all, the content will be too much to the extent that you might not be able to read everything and understand. Because when you chat on Google, they give you a lot of information to the extent that you may not even know what you are looking for. Or maybe you might be lucky to get in the first paragraph what you are looking for. But you may not have the time to read downwards. So your understanding is less. That is one. And two, there are some right medications to give that are not right for some people. You can have headache now. You are supposed to take paracetamol or whatever medication that I'm about to give you. But for a particular patient, they are not good for the person. They are right for the headache, but they are not right for the patient because of other associated conditions. It's only a medical person that can tell you that. Do you understand? Even among the medical people. Now, I'm a just graduated medical doctor December. You cannot compare my understanding about malaria to Dr. Tijan, Dr. Lako, Dr. You cannot. It's not possible. I might know the same medicine they know, but what you know about the medicine cannot be compared to what I know. So how about you that is just going to shout on Google to know about things? So it doesn't make sense. So go to a medical practitioner to tell you the right thing to do, or else you might be misled. You do the wrong thing.
Wow. So I want to know like wetin go take for Sierra Leone for make dem get a free malaria status, because we know say malaria na a life threatening disease and most Sierra Leoneans dem and the child mortality dem na the mocking faces, that is small small pikin dem, the death rate of this malaria. So wetin go take Sierra Leone for making get this free malaria status?
So first of all, a lot need for be done.
A lot need to be done.
Starting from corruption. How corruption comes in. Like I said earlier, there are a lot of questions. We get international donors, international partners, and this and that. Everybody is making efforts to end malaria and other conditions. But the first question that I don't have an answer is all that is entering, that is coming for the right purpose? We don't know. The one the way they receive, down to the lowest level. Like I said, people just dey focus on government, uh, president, minister, this. Yes, salon people are corrupt. Everybody, including us. In fact, if you want to be corrupt, they are going to corrupt you by force. But the focus is not only on them, even the community people. Mosquito net, for instance. Let's say WHO, CDC, or whatever health organization come with mosquito net now for supply. The caution is from the president or the minister of health down to the DHMT. Are they doing the right thing? The amount wey for reach na im dey reach? We don't know. You see, yes, Mr. Pasantiki Kamara wey dey na village, na na the chief, na the head. Everybody suppose forget one mosquito. He dey take 10 for himself and human dem. So e no care again whether dem reach at the least community. And let's say dem reach, let's just assume for the moment that there is no corruption, there is no breakdown, there is no cut here, put here. Then everything reach the village. How about the perception of the people? So we need for cut down, we need for correct the chain, which I think in the past still they reach to the least person, and then change the mindset of the people. Somebody then they get a mosquito net for let him put an in bed. In the use as sapo, in the use as fishing nets. When I say vaccine, instead of them giving pikin vaccine, people that they make sickness they want gangi. So we change the mindset also. We maintain hygiene, clean the community. Throw them panding. You understand? The gutter, they make them cover them. Make them protect vaccinations. Make them extend the vaccinations. Make them spread them far and wide to the villages. You understand?
Yeah.
And then make sure everybody be safe. Maybe in the next 20, 30 years, we will get 5% malaria. But for say malaria free community in Africa, so I don't to be specific, it's almost impossible. Although we pray and hope it happens one day.
We are hopeful.
Yes.
So I want to know something. How like you don't dey follow up? I know see you are a doctor now and you don't dey follow up. I don't know if you know about Dr. Austin Wemby, the current Minister of
Minister.
Health. So how far they don't they go with the health care na salon?
So from this government or the other government they
The
will not
present,
pass.
how you see the
No,
healthcare system
yes,
na salon they go
I'm
like.
coming. They all don't get a contribution.
Okay.
For me, I'm not in support of what people they say government no dey do nothing. No, e no possible. Say government dey do nothing. I no support that statement. They might not just be doing to expectation, but something is going on. You understand? Politician can kaya is snap, e make picture, exaggerate everything wey dey do. The exaggeration might be there, but something has been done, no matter how small. So they are doing their little best for make sure say effort go on for reduce infant mortality, maternal mortality, and the rest. There has been progress, no matter how small. So let us not tell you say the name is nothing is a lie. Something is going on. What will they pray for? For let everybody think about the people more than they think about themselves. That cut here, put here, cut wey dem give 10,000, you give 2,000, you keep the 8. That all. Now they pray for. But something developmental is going on every day. Every government wey can must do small thing towards that. The same thing with dis government. They are doing their best, and the minister we just dey see, we dey sit in there. You understand? Improvements dey go on. He's trying. I dey admire am a lot. You understand? He dey do im best just like the other people.
Good. Okay, so go actually know as a community person, I go on for no wetin na we own responsibility in order for make we able for combat this malaria.
Community get a lot for do.
Yeah.
When I can listen to the politician dem when they talk say the grassroots. I just like that statement, the grassroots. So the communities are the grassroots of anything, any action wey government wan take. So people dem dey fit put all the blame na government. No. People dem wey no dey think, just dey think political and dem dey put all blame na government. Government is not the only problem. We are the problems also. So the community get a lot for do. Starting with the cleanliness. Mango dey can use your go na village. Take am to the na the domot. Take am na the domot, you dey see dirty. The environment are not clean. Therefore, clean the environment. Community make effort. The goats are dem dey lock dem. Inside village, come out tell you wetin dem dey do. Inside village dem dey dig hole. You understand? Dem say na for throway dirty.
Wow.
Other hole dem go dig am, maybe dem wan build house, dem inside dem pull the dirty. Dat hole go left there. Dem no dey lock am. Water go settle there na all kind dirty water dey settle there na mosquito. If you go there, even when it's map, you dey see the mosquito there.
My God.
So all those things will be corrected. Who dey do that? Not government. One problem we face who get na salon is waiting for government for everything. E dey see rich person dey na im community, the whole dey spoil for go na im house. Im manage more na money for dragging mosquito take go na im, but e no dey make that line dey. E dey wait for government for cancer.
Wow.
So that mentality no
And
go
that
change.
na things wey dey happen
Yes.
even na your area sef.
That is it. So that's the same thing that applies everywhere. Everybody dey wait for government for kind do thing dem. Mosquito net issue. You dey buy expensive thing dem. How about for buy mosquito net? 10 Ghana room. No wait for government. The government dey carry the vaccine. Let's say okay, Lonsar now. Let's say dem carry the vaccine na Lonsar, na the vaccine dey. You in a village wey dey near Lonsar, why you no go take your pikin dem carry dem make dem can get the vaccine? You dey wait make dem carry your village. Even if na so e suppose for be, but make an effort so everybody get part to play. So we get our own part. Correct the intentions, community, like I tell you, redeem, we organize simple program, we go in a village, do them kind of initiative. Then imagine say we get support, everybody do the same thing, or we get bigger support from bigger organizations for support we for do the same thing. We can contribute something. Those are community-led organizations. You understand?
Yeah.
So the community get a lot to do. Everything is not on government. We should play our own part. Imagine say now road there, 3, 4, 5 rich people in there. Then just all man contribute. All man 30 stop na use. All the road in this community then for run it.
Exactly.
But everybody they wait for their government contract take an use, even if it much cap well. So now do community get something for do.
Yeah. So viewers, as you all dey agree wetin we doctor dey say, we all suppose for play part, and we are part of the change. And if you want for see change, we suppose for the part of the change. Let's implement wetin we dey we dey think, not only the government, we for play part. So I go want for make before I ask the last question, we conclude this session. So let's say you be Minister of Health now. What measures will you put in place in order for make the healthcare system na salon be intact or be as how e suppose for be?
If you mean now, I'm Minister of
Yes,
Health.
let's assume.
I'm a Minister of Health
Yes,
now.
Minister of
For
Health.
make sure say
The healthcare system
system.
na salon dey intact or be reformed.
Okay. So if I become minister now, first of all,
Yes.
the first what I do, the first problem we dey face na salon.
No.
For all ministers and presidents, one of the major problems we get, everybody facing get sense past the previous one. We focus now, we don't politicize everything. Now, the leadership for make we achieve, you get forget foundation. Let's say, for instance, the previous minister, what he do? He do A, B, C. Now C he stop. But let's say now only A he do. Only A he not even do C, he not do nothing. Now only A he not do no better thing. Now A no more do the previous minister.
Okay.
So when I come, what I do? I know they condemn what he do and start fresh. One of the problem we dey face na salon for the leaders and 900. Wey president Bill dey comot juice now. The next time wey dey come, im dey condemn all wetin president Bill don do, im go start afresh. Let's say president Bill stop na AB. Instead of im strengthen AB and then continue C and D, im dey come condemn A and B all, im go start from A. By the time e reach to C, im time don done.
Wow. I dey catch up something.
So you understand?
I dey understand.
So that is the problem. The same way the way dey now. This is not for this government. That is it. That is the trend. Anybody wey come na im get sense pass. All wetin the next person don do, he dey condemn everything. Im wan go start from A. So when I come, wherever Dr. Austin Dembe stop, I dey retain am, maintain am, and add me own. Rather than for condemn wetin im don do, then start me own.
Oh, yeah. So
You understand? There is a lot you can learn even from your enemy.
yeah,
Let's say I can now, Austin Dembe, let's say that SWP, for instance. Me, I can. CDC, CBC, whatever party, APC, whatever, I belong. That doesn't mean say, because me na APC, me na SWP, me na this, so party I dey. So this person dey na other party, I can, I not for work with, I know. For this, so, learn. I might not do 100% to see what they tell me. But make sure say I correlate your activity with my activities. Still, I don't standardize what you do. I correct some weak points and I now add my own. So that when the next person they come in, they move from my own, instead of standardize my own, who's having weakness, then instead move to the next. Rather than me go start afresh, and then will reach which other person reach. Or if I reach, I never pass.
And progress will be faster.
Progress
because
will be
like
faster.
you say, when two people work at
There is no national trend. That's the problem. America, no matter what I do, there is a national plan. You own the other. Not you own the can't map. You understand? And if I come if I be minister now, my focus is result oriented than announcement. One of the problems I know. Now more of what we they do, the target, we they do the activity. We they do the activity. But is it people centered that are they do actually foresee the changes where they happen? Or are they do for let people and just say, Minister Abu don't do this, so I will get opportunity for next team up, or are they do actually do because I want to see the impact on the people? That's another question. Where are the correct in line for if I be minister?
Oh, that's so
That
so
is
powerful. So
yeah.
powerful. And I think we all they get I hope we all they get from we doctor. So like myself don't learn something from what you say so. So and lastly I go want to make you give a word to those with the watch.
So me what I give to everybody when you listen or watch this is that malaria is a severe condition. It can be severe, it can kill. It can kill faster than any other disease we think of. So that all contributes. Forget for everything to government. He will buy your back, he will buy you citrus, buy mosquito nets. It's cheaper than that. Buy and put them. If you understand they sell them, even if it will be free, even if it's supposed to be free, if you understand they sell them, buy them for your own prevention. Clean the community. Do you understand? No wait for government to can organize program for clean the community. And now we know say now all our government support the government, which whatever government bring vaccine, but the vaccine they for go day or complement the government in effort for make you push for that you self go get the vaccine. You understand? Even when a leader within a village, government don't try to two mosquito they don't meet you. Make sure say the one away forget then get them. You understand?
Yeah.
Not thief for blame the government, for any bad name to the government, because not to the party belong. Because mother be not to the brother, not to the sister. That's another problem what they face. Doing things so that other person will get the blame. Let the person get the blame of putting thief, but you do correcting, you the under. You understand?
Wow.
So that will all come together and then try to prevent, be clean, go to hospital where you sick, not treat yourself now.
Okay. Thank you very much. I say you don't say all like waiting around for saying some way to the audience. So thank you very much. I'm so happy to get you here today on the podcast. So guys, don't forget for stay updated for me next podcast. And I love you guys. We love you.
Yeah.
Thank you, doctor.
Yeah. My pleasure.
See you.